You can go live now.
Good evening, doctors. On behalf of Hetero Healthcare, I, Dr. Prashant Khandeparkar, welcome you to this webinar on intimate hygiene. At Hetero Doctors, as you know, we market products in multiple therapy areas, for example, in gynecology, dermatology, gastroenterology, pulmonology, and ortho. We have a very strong R&D backup, which is why we try to develop products keeping patient benefit in mind. Our endeavor is to improve patient compliance, and ultimately we hope to improve the patient clinical outcomes. We have developed NSAID patches, reverse treatment patches for improving patient compliance. Gynecology, obstetrics, and IVF is an important therapy segment for us at Frenza, Hetero. And apart from conventional formulations like oral tablets of Didropal and Mylotin, we market products of vaginal health. We know you all know Feminora and Pelitra. Recently, we have introduced a vaginal film, a lactic acid film under the brand name Celeron. The film, besides containing lactic acid, also contains fructooligosaccharides. The purpose of this film is to correct the vaginal pH and maintain it at acidic pH so as to protect vagina from infections. To speak more about the vaginal conditions requiring film, the product, and share clinical experience, I have the pleasure in inviting Dr. Supriya Arwari today.
Good evening.
Madam, good evening, madam. Welcome. Dr. Supriya Arwari has done her MD from prestigious KM Hospital and GS Medical. I'm from GMC, madam, which is why KM is different.
Oh, wow. Always at loggerheads, huh?
Yes. Besides MD, madam is DNB, DGO, and FCPS. Practicing for more than 20 years at UND Supreme Hospital. Madam is National Coordinator of OXI, Adolescent Health Committee, Managing Member and Program Committee Chair of Association of Medical Consultants of Mumbai. Madam is faculty at various AISOG meeting, 2013 Mumbai, 2018 Bhubaneswar, Bengaluru 2019, Lucknow 2020, Indore 2021, and Kolkata 23. Besides this, madam has won many awards. Dr. Anandiben Joshi Award for Meritorious Service by Female Doctors, title of Mrs. Iron Lady in Mediqueen, Mrs. Maharashtra Beauty Pageant 2020, Mumbai of Obstetrics and Gynecological Society International Women's Day Award, and recipient of AMCOG V for Sri Puraskar at the from the hands of Honorable Governor of Maharashtra. Madam, it's a pleasure to have you today evening as a speaker. Welcome to you to this webinar. All yours.
Thank you. And without much ado, I think I'll start my slide share.
Yes.
Okay, so I hope my slides are visible.
Yes, madam, they are.
Okay, so at the outset, I would like to thank Dr. Prashant Khandeparkar for the kind words, and a pleasure to know that you are a JJ alumni. Yeah, it's a very reputed institute.
Yes.
And my dear friends who are joining us live on YouTube, it's indeed a pleasure, and I must thank Hetero Group, especially Bhavishi, for coordinating this webinar. Bhavishi has taken a lot of efforts to keep in touch and get this together. So let's talk about what are the recent advances in intimate hygiene health. Intimate hygiene, as we all know, especially as gynecologists, that it's a very important component of a woman's health, and in fact many a times a neglected component of women's health. And therefore, as practitioners, and especially as gynecologists, as caregivers to women, and as a responsibility of giving them a holistic health, it is also important that we should pay due attention to intimate hygiene of women. Intimate hygiene is all about keeping the private parts clean and hygienic, but easier said than done. Daily cleansing of the part vulva, the external genitals, should be done gently, and this is an important aspect of feminine hygiene and overall intimate health. The vagina as such is a self-cleansing machine that we know. Every month the menstrual cycle takes place. 4 or 5 days the bleeding occurs. After that, slowly the bleeding stops. Women may get some white discharge, And as such, it is a self-cleansing machine. Clear white vaginal discharge is normal, and it indicates that in fact the woman is perfectly healthy, hormones are doing well. Usually the pattern of the white discharge will be, just after the menses are over or just before the menses are expected. She can experience a clear discharge. Usually it is like a mucoid discharge. But if the discharge is smelly, it's of a different color like yellow, green, red, or it causes itching, soreness at the external genitalia, then there is a very high chance that there might be some pathology, and especially infection. The most common cause being infection. Here I must use a word of caution that vaginal discharge can also be a hairbringer of cancers, and therefore never to be neglected, especially if a woman complains of chronic vaginal discharge of more than 3 months duration. She should be investigated to make sure we are not missing early cancers. Vaginal flora and vaginal pH as such play an important role in intimate hygiene. How does that take place? The vaginal flora contains lots of lakhs of vaginal microflora, the microbiota or the vaginal microbiome. These are the microorganisms which colonize the vagina. In a healthy vagina, as we know, the human body is a swimming pool of organisms, microorganisms. So they are the good ones, there are the bad ones, and they usually coexist in our body. And usually the good ones gain control and maintain the hygiene or maintain the general milieu of the human body. Now, similar takes place in vagina, where there are the good and the bad microflora. And whenever the good microflora go down in quantity or in strength, the bad ones start proliferating, causing infection. So in a healthy vagina, both are there, they are coexisting in a balance. And the primary bacteria for a healthy vagina we all know this, are of the genus Lactobacillus, Lactobacilli, as we refer to them. And these are mainly the protective microorganisms against pathogenic organisms. Vaginal pH plays a very important role in managing or in maintaining a healthy vaginal pH and vaginal hygiene. The acidic pH of the vagina varies, especially with the menstrual cycle. Averagely, the vagina is more acidic, so you can have a pH between 3.5 to 4.5. The increased acidity forms a natural protective shield to prevent harmful germs and other microorganisms from intruding. A pH above 4.5 makes the vagina, now that means now we are going towards an alkaline pH. The vagina becomes more susceptible to vaginitis, inflammation of the vaginal tissue. Lactic acid, which is produced by the lactobacilli, supports the maintenance and restoration of the natural healthy vaginal flora. And therefore, vaginal pH should be determined by the sum total of the lactic acid production by the vaginal mucosa and the microbial flora that is inherent of the vagina. So it's very important. This is a small diagram which shows us that always the vaginal pH is more on the acidic side. This is just a flow chart showing us how the vagina maintains its pH. There is the vaginal mucosal membrane. The lactic acid bacilla convert glycogen into lactic acid. The lactic acid increases the acidity of the vaginal flora that hampers the growth of pathogenic organisms. Also, colonization of the lactic acid bacteria, all these act hand in hand. They cover up, make a protective layer on top of the vaginal layer, and therefore they prevent organisms, pathogens from invading the vagina. So this is how the natural mechanism goes. Lactic acid produced hampers the growth of pathogenic bacteria, colonizes more lactic acid bacteria, so it is a self-propagating process, induces more lactobacilli growth, and creates an acidic environment that is a pH between 3.5 to 4.5, thus regulating the vaginal pH. Now, normal vaginal flora, which has an acidic pH, and vaginal discharge are all components of the innate defense mechanisms that protect women against vulvovaginitis. What is the pathology? Now we have discussed the physiology. What is the pathophysiology of disturbed vaginal health? Usually the risk factors are various. age, lifestyle, how much care a person gives to personal hygiene, how many partners the person is having. Several of these factors will make this lady a high risk for increased infection or increased inflammation of the vulvovaginal area. When these risk factors are present, there is usually a decrease in the vaginal lactobacilli. Therefore, there is a decrease in the concentration of hydrogen peroxide and lactic acid, which are naturally produced by lactobacilli. This in turn will lead to increase in the outgrowth of pathogens, because there is a increase in the acidity, increase in the alkalinity, reduce in the acidity. So there is a rise in pH, and all this can give rise to increased overgrowth of pathogens. The pathogens then will cause vaginal infection in the form of discharge. The discharge may be malodorous. It may have various colors depending on what is the causative organism, and it may lead to certain very dangerous side effects like infertility and STIs, or sexually transmitted infections. Now, what are the symptoms of an unbalanced vaginal pH, or what are the symptoms of vaginal infection in short? So there can be a lot of discharge, which is usually strong. It is like a very malodorous fish-like smell. The color may vary from gray, green, foamy, greenish vaginal discharge. It may be curdy discharge if it is a fungal infection. It will be associated with itching around the vagina. There will be swelling and irritation of the vagina, the vulva. There may be even soreness in the groin. The woman usually has a burning feeling or very intense pain or intense itching, especially during or just after sex. And she may have a lot of burning during urinating, because urine is a very acidic in nature. Because of the excoriation of the vulval skin, secondary to infection, when the acidic urine falls on this excoriated skin, it can give intense burning. It is very, very uncomfortable and distressing for the patient. Menstrual cycle also dictates what is the pH of the vagina, and therefore women may experience change in the vaginal symptoms or vaginal discharge depending on which part of the menstrual cycle they are in. Now, menstrual blood is alkaline, pH is very high, 7.4. So what happens during periods? The pH of the vagina is elevated. Most women's bodies will handle this situation and they will adjust so that they do not land up in trouble. But some may find this difficult to handle and they become prone to infection, especially during or after menstruation. So you may find many women complaining that just after periods, there is a lot of itching, or during periods, there is a lot of itching. And also added to it, you can imagine the plight of the poor woman. She's having intense itching, intense discomfort. On top of that, she's using sanitary pads, which are, causing a lot of friction. You can imagine the plight of that poor lady. Medication can also be a factor in causing vaginal infection. How do the medications affect? Especially antibiotic use, if given for prolonged time, then the antibiotic medication can kill the natural or the normal bacteria, thereby reducing the lactobacilli, thereby causing infection because other pathogens start growing. Same effect can be seen by use of OC, that is birth control pills. They also change the vaginal pH, and therefore there may be women who sometimes are using birth control pills and they come with, infection or repeated itching in the vaginal area. Douching. Now, douching is a method wherein you clean the vagina from the inside. Externally, it is easy to clean. You just apply some soap, water, or some intimate hygiene product and wash. But douching is where you actually flush some fluid inside the vagina, and therefore you cleanse the vagina, causing the, all the irritant material, the bacterial or the fungal discharges to come out. You squirt some pre-packaged fluid or mixture into the vagina and either use a tube or some other tool, and this process can raise the vaginal pH. Although it's not a very easy process to do, especially to do it on your own. Lubricant gels. Now, lubricant gels can cause a lot of they reduce the dryness in the vaginal area during sex, and therefore many women use lubricants. But lubricant products also have a pH which is higher than 4.5. So they are more alkaline, and therefore they can also predispose women to having more vaginal infection because the bacteria get killed. Breastfeeding and menopause. Now, vagina, vulva, all the women internal sex organs are very, very estrogen dependent in women. During breastfeeding or during menopause, physiologically, there is a lot of drop in estrogens. And estrogen plays an important role in keeping the vaginal pH intact and acidic. When women breastfeed, or when they beginning of menopause, or when few years into menopause, the estrogen levels drop very low, and therefore they can have resultant vaginal atrophy causing higher pH, and subsequently they are more prone to having repeated vaginal infections. Now, this is the current treatment that we design for vaginal infection. Especially, this is now the antimicrobial therapy. For that, we need to have a brief outline as to how we can identify that this is a particular type of infection, and accordingly we can give the treatment. If we have to talk broadly, we should know that the fungal infections, especially the candidial group of infection, that causes a curdy discharge. So patient will complain that फटे हुए दूध के जैसा या दही के जैसा discharge होता है. So that is a fungal discharge. Needs to be treated with fungal infection, antifungals. Then we have the trichomonal discharge. Now, trichomonas usually it's a frothy greenish discharge. Again, it is foul smelling and it will give intense itching. Then accordingly, the treatment we will know. These are the two most common that we encounter. So if it is a fungal infection, then clotrimazole is a topical agent that can be used. A note of caution at this point of time: many creams are available as a combination with steroids. Steroid use should be strictly avoided, and if at all, we should use some mild steroid, and that too for a very limited period of say 3 to 5 days, with clear instruction given to the patient not to use the local topical steroid cream for more than 3 to 5 days, because in the short term they will cause elevation of symptoms, but in the long term it is going to give more and more infection because it is going to suppress the local immunity. So steroid creams to be used with caution. Miconazole again available as a topical cream. So clotrimazole 1% or miconazole 2% cream can be used daily. They are also available as vaginal gels or vaginal pessaries that can be used. We in fact use it quite commonly, especially during pregnancy, when we would like to avoid oral drugs in pregnant ladies. Nystatin is the only preparation for topical use on the skin, which is non-prescription drug. Now in India, prescription and non-prescription drugs, the line between them is very fine and very sometimes interchangeable. But all the same, this is again available as a vaginal insert or a cream. Turconazole, not very commonly used. There was a time when a lot of local application turconazole creams came in fashion, but I don't think any longer we use too much of it. Fluconazole usually is the drug of choice for oral drugs. This is again very cheaply available, common, and very minimum side effects, but to be avoided in pregnancy as far as possible. 150 milligram either as a single dose or in recurrent vaginal discharge or recurrent candidiasis can be used as a weekly dose. 3 to 4 doses can be given. Always it is important to treat the partner simultaneously. It is not sufficient to treat the woman, because next time when she goes to her partner to have sex, she is very likely to re-contract the infection. So always remember to treat the partner also. Metronidazole is a drug of choice for trichomonasis and bacterial vaginosis. Bacterial vaginosis is again another very common cause of vaginal infection. This can be used as an oral or a vaginal preparation. Oral drug, either we can give like a 2 gram stat. Many kits are nowadays available which have fluconazole with 2 grams of either metronidazole or some drug from the imidazole group like secnidazole, tinidazole. So that can be given, or we can give 500 BD for 7 days. For bacterial vaginosis, 500 milligram BID for 7 days. Ketoconazole, a second line of drug for vaginal candidial infection, means fungal infection, given orally, not regularly recommended, except suppose there is a long-term infection or repeated infection. 400 milligram twice a day for 5 days. Clindamycin is a drug of choice for bacterial vaginosis. Bacterial vaginosis usually causes a milky discharge and also is a very important common cause of vaginal infection. Available as a oral use or vaginal use as a cream. 300 milligram BID for 7 to 10 days is the course, and for local application you can use a 2% cream. So this more or less sums up how we will be treating the pathogen that is behind the infection. Although this will cure the infection, the disturbed vaginal flora is not going to be reinstated, and therefore the root cause will not be addressed. And that's why we, to give long-lasting results, we can't just rely on antibiotics or antifungal agents. So what are the current treatment available to reinstate the vaginal pH? We have the lactic acid wash, suppositories, gels, capsules or ovules. The wash is what is most commonly used. It can wash out good bacteria also because of the lack of adherence to vaginal surfaces. Leakage issues with suppositories, because once you insert the suppository, patient may say next day the cap is coming out, capsule is coming out, or there is some leakage, and they find it very discomforting and messy. Vaginal gels also are messy. Application is very difficult. So also with the soft gels, because sometimes they're really big in size, and inserting them vaginally becomes a big issue. So we basically need the right therapy option for sustainable result in balancing vaginal pH. And that now is available in the form of a lactic acid vaginal film. Now, what are the advantages of the vaginal film? There is a longer residence time. It is a film, so it is going to get absorbed slowly. It's not like a gel or fluid which will just wash off. So it will stay there for some time. So it will give more time for the action to take place due to the use of bioadhesive polymers which are impregnated in the film. There is no question of leakage. It's a dry film, so it's not going to leak out. And patient comfortability is so much more because it's a very flexible, thin film. So easy to put inside. It will not hurt the patient. She will not feel anything, and it will be not messy also. Storage is easy. Carrying a bottle of lactic acid bacillus wash is very difficult, but carrying a small film around is very easy. Also, there is an increased stability at extreme storage condition, extreme heat or extreme, cold. Okay. Then faster drug absorption. So good action will come faster. Much better than the conventional products. This is what Hetero has come up with. It's a very revolutionary concept and very good concept where, very, very easy to use, very easy to handle. Putting a gel inside is very difficult, but just inserting a small film is very easy. So this is what I think is a great product, and we should try it on our patients. I'm sure patient feedback will be very positive about the Silero. Okay, it restores the imbalance of the vaginal microflora, restores vaginal pH, promotes the growth of lactobacilli, and secretes antibacterial substances in addition. Balancing the vaginal pH is one of the main components of how it acts. So this is how the product information goes. I'm sure the hetero people will be happy to shed more light. How it is to be inserted? Very easy. The patient should first wash her hands, then cut the cover which contains the film and remove the film from the cover. The patient should then roll the film into a small fold on her dry fingers. If she moistens her fingers, it may become difficult to insert. So ask her to wash hands and dry them, then roll it into a small film. And the patient should then sit in a comfortable position. She can sit on the toilet seat or she can squat on the ground and insert the film into the vagina. And then after that, again, patient should wash her hands so that she maintains overall hygiene. Dosage is one thin film to be kept in the vagina at bedtime for 5 to 7 days. So I think this more or less covers the topic in a very elaborate fashion. And I must thank Hetero team for giving me such lovely slides, made my job very easy. And I hope it was, as informative as it was for me. It was a great learning experience going through these slides. So thanks to Dr. Prashant and his team. And
thank you so much, madam. Thank you. It was a lovely session. Now, we have got quite many questions. I'll just go one by one.
Yeah.
How common is this vaginitis post-diabetic in diabetics?
I'm very glad this question has come up.
Yeah.
Diabetics are one of the most common, symptoms that diabetic women will have. Is vaginal infection. In fact, many a times the gynecologist diagnoses the diabetes when patient comes to the clinic repeatedly. We advise them to do sugars and they come with a increased sugar level.
Correct.
Yeah, and fungal infections are most common in them. Candidiasis is most common in them. Yeah.
Now, another thing you said very clearly that corticosteroids should be avoided as topical.
Absolutely.
Now, people who are on inhaled corticosteroids, are they also at risk?
Absolutely, they are at a very high risk
even inhaled,
of vaginal infections, itching, irritation. Steroid use is really horrible on the patient.
Correct.
The doctor should, practice at most judicious use of steroids. Never to give unindicated.
And how do we know once you start the treatment? How do we know that patient is responding? The symptoms get reduced.
Definitely, the symptoms will get reduced, but we must always counsel the patient that these infections can come back. And therefore, they may need long-term, especially if we are using probiotics or vaginal products. They may need to use it over a long period of time.
Long period of time.
Yeah.
You generally prescribe for 7 days.
7 days, and after that, whenever she's symptomatic, she can take a repeat therapy.
Yeah. Would you use it along with the active treatment, especially topical?
Yes, actually, more than topical, especially if she's on oral trelement, antibiotics, then it should be used as a co-prescription.
And topical?
Topical, see, yes, it is. See, using a vaginal film is so simple that frankly, no other treatment is going to interfere with it. Even if she is using topical creams, she can insert the vaginal film first and then apply the topical film.
Correct. They can space it
so
out,
that it does not interfere with each other.
They can space it out. How safe is intimate vaginal care during pregnancy?
Absolutely safe.
It should be safe.
Because it is not getting absorbed into the blood.
Absolutely.
It is acting locally.
It's a very interesting question. What is the incidence, how of patient, if the patient is an estrogen inhibitor, like for breast cancer, would they get these infections?
Yes. Because of lack of estrogen,
their estrogen.
Not only the infection, in fact, these patients are more prone to atrophic vulvitis also. And therefore, the doctor should always be vigilant that all vaginitis may not be infection.
Correct.
There are other causes. Like I mentioned, there could be cancers.
Malignancies.
If there is a lady who has breast cancer, she could also have inherent risk of endometrial cancer.
Absolutely.
So I would be more vigilant on her.
Correct.
And because she's using some therapies, she's on chemotherapy, she's on prolonged steroid therapy, she's very prone to vaginal infections.
Absolutely.
And it is our job to make her more comfortable by treating it.
Correct. So one question, interesting question. Will the film interfere with episiotomy healing?
Frankly, at the time of episiotomy, when you're giving an episiotomy, if you have noticed as a practitioner, I can tell you that blood is continuously flowing out, lochia is continuously flowing out, but still very few patients are complaining of vaginal infection. That is because nature takes place, nature looks very beautifully. But even if required, I don't think there should be any issue. Once it is inserted inside, it is going to dissolve over the next few hours. It's not going to cause
interfere with healing.
Patient has to be just counseled that she should be careful when inserting. She should not hurt herself.
Absolutely.
By breaking the episiotomy wound.
Now, generally, we recommend the film to be used at bedtime. So, would it make any difference if someone was to use it only in the afternoon, say maybe the time?
Not really,
Or-
because in fact that is the advantage. You use it any time of the day. It's not going to leak
But
out.
keep the same time. Keep the
It's
same
not
time.
going to soil your
Correct,
clothes.
correct,
It's not going to interfere with your daily life. If you're a
Absolutely.
working woman or if you're working in shifts, you can use it in the afternoon, no problem. Try to keep the time same. If you're using it in the afternoon, use
Yes.
every afternoon.
Every afternoon.
Yeah.
I mean, it's too early to ask, but what is patient experience on this use of this? Has patient said it's good? I mean, I tolerate it
Yeah,
well.
they are so much more comfortable rather
Comfortable.
than carrying
It's
bottles
really
around.
early to have this.
It is too premature to ask,
Yeah,
but
yeah.
I
Correct.
feel it is going to be extremely good, especially for working women, because it's easy to carry
It's
around.
easy to carry.
It is easy for women working in shifts. It's also
Absolutely.
easy for us. Suppose husband is coming home late and he wants to have sex. Then
Yeah.
what will she do about putting the film? She
Absolutely.
can use it in the
In
afternoon.
the afternoon. Correct,
Same
correct.
cannot be held true with gel, because the gel will mess her clothes and
Correct,
everything
correct.
during the daytime. Yeah.
I think that is all, madam. If there's anything, we'll come back to you. It was a nice session hearing this session.
Same
We
here.
got a lot of new insights. Thank you so much.
Thank you
madam,
so
once
much.
again.
Thank you.
Thank
And
you, all the
thanks to
doctors.
your team. Thank you to
Thank you so much.
Bhavishi.
It was a pleasure. Yes.
Yeah,
Thank you.
thank you, sir. Thank you, doctor. Bye-bye.
Bye.